I'm David Rowe from Rowe Chiropractic Offices, and I'm here with Russ. Russ had a vertigo incident 2 weeks ago tonight, and we've been working on his upper cervical, and as an individual subluxation, his atlas is subluxated to the right and posterior, so this is his pattern, and like this, and his head is shifted globally to the right. So we're gonna adjust him from right to left on his atlas, the top vertebra. That's a Gonstead adjustment. And then we're gonna do some chiropractic biophysics drop work to pull his head over. We're gonna also do some therapeutic exercises, but let's get him adjusted first and get some of the pressure off here. So when in a ASRP atlas, he has a restriction in right lateral flexion. It's certainly better than it was 2 weeks ago, but it's still stuck. And he has a restriction in left rotation. So the vertebra has shifted this way and rotated like that, and it's stuck there. So we're gonna create an adjustment. Russ, I know you're on camera, but you'll just let everything relax. So we're gonna side bend this way, and then just let the weight of your head drop into my right hand. Beautiful, perfect, you did great, super. All right. Good, that's it. That's the adjustment for that. Let's go ahead and do the therapeutic, let's do the actually drop work next. There's a second piece of this, is that posturally, his head is shifted to the right. So if this is the middle of his cage, the head is shifted to the right. So we're gonna do a drop adjustment from the protocols of chiropractic biophysics, CBP, where we're gonna shift his head from right to left. Now Russ will do a lot of this work. We're gonna use a drop mechanism just to show you what the drop mechanism's like. If we push on the table, it drops rapidly like that. Now, Russ knows a therapeutic exercise that he's been doing for years, where he pushes his head like this. So I'm going to get him to activate the proprioception, the where is he in space, the how does he move his body. He's going to do the maneuver 3, press down against the headpiece, keep pressing. Go ahead, Russ, press, you're doing great, brother, and like that. Good, let's see if we can get a little bit more pace on that, a little bit more snappy. Press down and push, bravo. I'm gonna take this one pad away, so we go a little bit deeper, a little bit further drift, and you're gonna press down. Now you're always pushing with the ear lower, we're not side bending, we're shifting. You're shifting like that, great. So what I want you to do is to press down with your head and push. I'm still covering the right atlas, press down, push, come on, push, brother, push, bravo. Fantastic, good job, man. Just swing off and sit up. Beautiful, and that's how we fix that. Now he's gonna do the last thing we're gonna do in terms of the adjustment, he's gonna do what's going for him as maneuver 3. It's a left head translation. His eyes are looking straight ahead, so we're just gonna keep you like this. That's great. And you're gonna shift your head to the left, and shift and push over here. That's great, you're doing great, man, super. And then I'm gonna use this impulse instrument to hit certain neurological beds, and come back, let's do that again. And we're gonna shift the head to the left, that's fantastic. And the densest of those neurological beds is in the upper cervical, so good, shift, brother, shift, you're doing great. Good, 8, 9, 10. You got a little bit of right nose rotation. Well, let's get you in the center here. So when you shift, we're gonna shift without rotating. And sometimes we have to go through this in detail with patients. So push your ear against my hand, fantastic. Keep the shoulder down, shift again. You're doing great, man, shift. Good, keep shifting, full 10 seconds. Good, use those muscles, keep shifting. 8, 9, 10. Bravo, you did great, super. That's it, how do you feel?
Yeah, I feel like I'm back to normal. Like, as of last weekend, I feel like I'm back to normal. I feel like I've been normal this whole week. And it's so great. Because this is just an awful feeling to be like, if you are a person who likes to be in control or something,
which is
like,
most of us.
Well,
yes.
Yeah, it's a very
disorienting,
uncomfortable feeling to be off balance and to be spinning.
And from my standpoint, one of the important things is because you lay down such a foundation of long-term care, that you've done a lot of the work. Mm-hmm. It's not to say that you're never going to have a trauma, you're never going to have a crisis, you're never going to have something that you're going to have to deal with. But because we've worked on your spine so much that we can pull you out of such a substantial flare up relatively rapidly, and now you're cruising along again. Stuff happens, but because you've done the work, I think that's really the big point. And the more that we take responsibility and say, I'm going to care for my spine, whether I'm symptomatic or not, so that my brain can talk to my body and I can be as healthy as possible, that's really what sets the foundation that allows us to get you over this. Thank you so much for participating in this. I really appreciate it.